Is there an age limit for hormone replacement therapy? The guidance around hormone replacement therapy, now more commonly called menopausal hormone therapy, has been a confusing roller coaster for decades. Fortunately, the latest science and updated guidelines from major organizations like the Menopause Society have made things much clearer. Here's a breakdown of the most current consensus and recent studies as of early 2026 regarding age limits and hormone replacement therapy. The general medical consensus remains that the safest and most beneficial time to start systemic hormone replacement therapy, also known as HRT, that includes pills, patches, and gels, is before age 60 or within 10 years of the onset of menopause. Menopause is defined as 12 full months without a menstrual period. Studies consistently show that when started in this window, the benefits, relieving hot flashes, protecting bone density, and potentially lowering the risk of heart disease and diabetes, typically far outweigh the risks for healthy women. The newer data in 2025 even highlight that starting estrogen therapy during perimenopause, and that's the transitional phase before periods stop completely, may yield the best long-term health outcomes regarding heart and brain health. Now let's look at initiating hormone replacement therapy after age 60 or 65. For a long time, women were told that starting HRT for the first time after age 60 or more than 10 years past menopause was strictly off limits. The thinking has evolved from a blanket ban to a highly individualized approach, though it remains a delicate balance. There are some risks. A major large-scale study published by the Menopause Society in February 2026 confirmed that initiating systemic hormone therapy after age 65 still carries elevated risk compared to starting earlier. Specifically, older women starting HRT have a higher risk of cardiovascular events like stroke or heart disease and certain cancers. But there are a lot of nuances here. Despite these risks, the Menopause Society emphasizes that there is no longer a one-size-fits-all rule. If a woman over 60 is suffering from severe persistent menopause symptoms that are ruining her quality of life, she can still explore HRT. Additionally, if she has osteoporosis, there are also benefits to starting HRT in a later age. If a doctor and patient decide to initiate HRT later in life, the risk can be substantially reduced by using low doses and transdermal estrogens such as patches, gels, or sprays rather than oral pills. Transdermal estrogen is absorbed through the skin and bypasses the liver, meaning it does not carry the same increased risk for blood clots or stroke that oral estrogen does. There is no age limit to stop HRT. It is crucial to distinguish between starting HRT late and staying on it. If you start HRT in your 50s, the current guideline explicitly states that there is no mandatory or arbitrary age limit to stop taking it. You do not have to quit cold turkey at age 60 or 65. Women can safely continue hormone replacement therapy into their 70s and beyond, provided they have regular medical evaluations to ensure the benefits, like symptom relief and bone protection, continue to outweigh any individual risks. There is an exception, which is vaginal estrogen. It is very important to note that these age limits and timelines apply to systemic HRT. That means treatments that circulate throughout the whole body. Vaginal estrogen, however, is different. Localized vaginal estrogen, this includes creams, inserts, or rings used to treat vaginal dryness, painful sex, and recurrent urinary tract infections, also known as UTIs. Localized vaginal estrogen stays localized to the pelvic tissue. Almost none of it enters the bloodstream. It can be safely started at any age, even well into a woman's 70s or 80s, and continued indefinitely. The bottom line, if you are under 60 and within 10 years of menopause, starting HRT is generally considered very safe and highly beneficial. If you are over 60 and want to start, it's no longer an absolute no, but it requires a careful, personalized conversation with your doctor to weigh your specific cardiovascular and cancer risk factors against your quality of life.